I've worked in occupational health in the UK and in New Zealand for about the last 15, 16 years, and I have seen progress made. However, when I first came to New Zealand about 8 years ago, it was a wee bit of a shock when I compared it with the UK standards. So because we're at a construction breakfast, I found this quote basically about bricklayers. And it says, workers of this sort are mostly drawn from the peasant class, so don't take offence. So when they're attacked by fever, they betake themselves to their huts and leave the affair entirely to nature, or else they're carried off to hospital and they're treated with usual remedies, purging and venesection. For doctors know nothing of the mode of life of these workers who are exhausted and prostrated by unceasing toil. Now, that was a quote by Bernardo Ramazzini in 1700. And what it does show is that people knew about hazards in the workplace even that far back. So there is no excuse nowadays for people not to actually look at occupational health and the, the health of their workers. So respiratory statistics, these statistics are taken from ACC, and about 15% of both chronic obstructive pulmonary disease and adult asthma can be attributed to occupational exposures. So that's actually quite significant. But we do know that with all occupational diseases, if we control the exposures, we can actually eliminate these issues. Any substance can cause harm, whether it's something that you buy at a supermarket or whether it's something that you're actually working with in the workplace. It depends entirely on what the substance is, but also the dose of the substance. How long are people exposed to it? What is the concentration of that substance? The route of administration, and also the susceptibility of the individual. And that's where occupational health comes into it. If people are exposed to dust or fumes or gases in the workplace, we need to make sure that they can actually cope with that and cope with the respiratory protection that's required. So there's various routes of entry into the body. We can inhale stuff. The skin can absorb stuff. We can ingest it. I'm not suggesting that people go out and eat bars of lead or anything, but we can ingest it, and also inoculation. And these can actually cause local effects. For example, if someone's working with chemicals, they may get a little dermatitis on their hand or something because of the exposures. Or there could be systemic effects that can actually cause major organ deficits if you have long-term exposures to some substances. Types of exposures could include dust, fumes, mists, gases and vapours. So there's a whole load of stuff. And it is into the workplace that we need to make sure that people aren't exposed to these unnecessarily. It always comes down to risk assessment in most things that we actually do within the workplace. We need to look at the contaminant, look at its nature, its toxicity, its form, its concentration. The level of hazard, what is the size of particle? Is it so small that it's going to get into those very, very tiny capillaries in the body? The working conditions, are people having adequate ventilation? Are they working in confined spaces? What are the oxygen levels? Really important. Temperatures, or is there a huge combination of hazards? And not everyone knows where to start, as Donna talked about. So if you don't know, get some help. Certainly within TriEx, we have occupational hygienists as well as safety professionals as well. Get some expert help in to help you. That is not an option. I have been on many work sites where no respiratory protection has actually been worn. People have held their breath going through like a big dust cloud. So it is important that people are aware that this does not protect you. So there are different types of respiratory protection out there, and if you're not even sure about what hazards you're exposed to, how do you know actually what type of respiratory protection to wear? So we do have disposable dust masks and particulate filters. Lyndene's actually going to talk through the actual fit of the mask, and I'll be the model, actually putting the mask on as such. If anyone can't see, if you're at the back of the room or something, come up to us afterwards and we'll talk you through it. So types of masks, often they have either a P1, P2 or P3 value. Now, as an occupational health nurse, whether people are coming into TriEx or whether we're going out to the workplace and doing annual testing, one of the questions we do ask is, what respiratory protection do you wear? We always encourage people to bring the respiratory protection with them. It doesn't always happen. We can go through the maintenance of that protection. We can go through, have you got the correct filters on? How often are you changing them? Are you getting a good fit? And certainly with respiratory fit testing, I don't know if you can see the big mask down there, the big hood. With respiratory fit testing, if that is done alongside your spirometry testing, then you're working to best practice as such. But it is important that you do have occupational health professionals doing that testing for you rather than technicians. Cartridges, different cartridges out there. Again, it's kind of going deeper and deeper into what people are actually exposed to. So gas and vapours, letter and colour coded. And then you also have numbers available depending on the capacity parts per million for exposure. And if you're not sure, go to the professionals again, go to places like 3M to get some advice, or to NZ Safety to get some advice about your protection. So fit testing, the actual fit of the respiratory protection is of utmost importance. If you don't have a good fit, you're still going to be exposed to that hazard. Annually, apart from the spirometry to check out your lung function, you should be doing either quantitative or qualitative fit testing. And that's mandatory under Australian and New Zealand standards for close-fitting respiratory protection. Protection factors only apply when people are fit tested and wear and maintain their respiratory protection well. If people have facial hair, how can you get a really good seal with respiratory protection? Whether it's a half face or a full face, you need to have that good seal there. So there's a picture of the hood with the qualitative, and then the port-account machine with the quantitative for fit testing. So Lyndene is going to talk us through how to actually wear a disposable and then a half-face mask.
Is this one working now? Okay. Good morning, everyone. Yeah, it's great to see a great turnout today. And yes, as Donna alluded to and Karen alluded to, my background goes back 20 years in occupational health. My first 10 years of those was representing a company, coincidentally 3M that you mentioned earlier, as a respiratory specialist throughout the South Island. So I spent 10 years out with industry, and my main role was education and awareness around the correct use of it. In those days, infancy of the Health and Safety Act, and also of even some of the respiratory standards. So it was quite new to a lot of people, but here we are, 21 years down the track, and it still is new to a lot of people, as Donna alluded to. So the more we can get the message out, the better. So Karen's kindly going to be my model today. Okay, so there's different types of respirators. We can't go into them all today, but the most common type, because of their accessibility, maybe because of cost, maybe because of your work needing to be mobile, etc. You're not going to be able to drag airlines around with you on your construction sites, climbing up and down ladders, etc. Would be the half mask respirators that are commonly worn for protection against dust, and worn correctly. And by wearing approved respiratory protection like this, you are going to get effective protection as that minimisation, the last level of defence. So a disposable respirator like this, so most should be carrying some form of standard approval. We will put the respirator on quite simply, cupping it over the face, bringing the strap to the top of the head, and then the second strap over the ears around the back of the neck. Most of these disposable types will have a moulded nose clip available, and so with 2 fingers, 2 hands, we gently mould that nose clip down around our nose. Everybody's nose is different. Crikey, look around the room. Some have got major honkers. It's quite a job to get your fit correct. And also, we've got a lot of different size faces in our workforce. Over the last 21 years, the diversity of our workforce has changed, and even since the earthquakes, the diversity of our works group, different ethnic groups, a lot more females in construction. So one size won't fit all. Go out, work with your safety supplier, work with your safety professional, make sure you have got a variety available, because this respirator may not fit that tiny Filipino worker you've just employed or that petite woman that is working over on the other side. There are flat fold respirators, there are different sizes available in the cup respirators. Make sure you investigate and get one that's appropriate. As I said, luckily Karen had a shave this morning, so she's all good. No facial hair happening, so we're looking good. Tight-fitting reusable respirators. So once again, these come in a variety of formats, different manufacturers, but most of these types will at least carry a small, medium and large face piece size. But even within manufacturers, they are quite significantly different. So if I hold, you may not be able to see from the back, but there is a good inch or two in difference in size of that respirator. So once again, making sure you've got a variety and that your workers are fit, checked initially and then fit tested to know what size they are wearing, and that is documented and monitored to make sure they're getting that respirator. So with the reusable respirators, the straps, we put and here's an indication of some of the challenges involved in wearing respiratory protection when other either eyewear or personal protection is worn. Ensuring those straps are firm, Karen's going to adjust her strap on the head harness, worn up on the crown of the head, and put her back strap around the back of her neck. She'll be adjusting the elastic to make sure there's a good firm fit. It's comfortable, there's not going to be any slippage as she works. And we are ensuring that it's compatible with other PPE. If she's wearing her safety glasses, that doesn't dislodge it when she pops them on. Earmuffs, your hard hats, other devices. These all need to work. You need to try it all out together. One can't compromise the other. And we definitely don't want fogging of eyewear, what another risk that would pose. So we've popped that respirator on. So annually you'll have your fit testing, so that's going through the qualitative or quantitative fit testing regime, all certified off. But every time that respirator is put on, your worker must be aware they need to actually check the seal of their respirator. So with the reusable respirator here, the half mask, we cover the exhalation valve at the front of the respirator, or underneath in this case, Karen, under there. And we breathe out gently, and we should feel the mask bulging up on our face and no leakage around the respirator. If there's any leakage, we need to do some adjustments of our head strap to ensure that we get that good positive seal. And the other check is to do a negative check. So this one we're actually going to block off where the air is inhaled, in this case in the filters. We cover the entrance to the filters and we inhale sharply, and we should feel the mask collapsing in and sucking in onto our face. Don't hold it too long because we do want you to carry on breathing. Excellent. So Karen's got a good seal. Once again, if that wasn't working, then maybe she needs to adjust. If it's still not working, then maybe she needs to have a good look at it. Did she inspect it correctly? Is there some part missing on the respirator? Or is it the fact that she's actually picked up somebody else's respirator by mistake and it's not the one that fits her face? So we need to ensure that every morning, every time. Can you cover the one with the disposable? That can also be done with your disposable respirators. You can also quickly do that negative check, covering the face piece, sucking in, and you should feel the mask collapsing on the face. So, as I mentioned, if it's not working correctly, it could be due to bad maintenance. So we need to make sure that the integrity of the respirator is always kept. These reusable ones particularly have got a number of parts, the head harnesses, the cradle, the elastic straps. We have valves and gaskets. They must be all intact. They must be have good integrity and seated correctly. No parts missing. Some respirators you can get spare parts for. Some are throwaway. If something goes wrong with them, you throw them away and you get another one, priced accordingly. So you need to choose what best suits your workplace, suits your program, and how you're best to manage that. Filters will be changed depending on what type of filters they are. Filters like this, which are particulate filters, they will get changed when they are clogged, when breathing resistance increases, or if they become damaged or contaminated. With the carbon filters that take out our gases and vapours, then we would change them out if we get in immediately if there's any breakthrough occur, so if we can actually taste or smell the contaminant, but preferably you'd have a change out schedule. You'd understand that on the average these filters are lasting for 10 working days, so maybe you put in an 8-day change out period as a safety factor. Once again, if there's any damage to the cartridges, you'd also replace them if they get wet or damaged. Checking for the face pieces. In these cases, there's no deformities, cracks, or any wear, or basically anything that's going to affect that seal on your face. Elastics being in good intact, the head straps on your full faces or half masks being able to be adjusted. Often in industry, I see people have made these DIY makeshift repairs and tied the elastic on their strap. There's no adjustability when they've done that. Cleaning and hygiene standards are really important. Donna alluded to the ear infection from the mouldy ear muff. Similarly, you'd be sick at some of the sights of respirators I've seen people putting on their face every day, chucking them into a back of the ute or underneath their toolbox or at their bench in their grinding workstation or whatever. It's hideous. So really encourage people to clean them at the end of the day, have available respirator wipes and stations around your workplace or in their toolbox, in their utes, etc. So they can give them a quick wipe out, pop them away in a airtight container safely for use the next shift. So clean and dry, store it away nicely. Don't use any of your harsh solvents or chemicals thinking that you're going to give it a really good clean, because they will degrade the plastic and rubber components of the respirators. Okay, thank you.
So back to health a wee bit now. Basically, individual challenges. As Lyndene said, not every face is the same, so there are challenges. Not everyone's health is the same, so they can cause challenges as well for people wearing respiratory protection. So people susceptible to asthma may have an attack precipitated or may have issues with certain types of respirator. They may actually need an airflow rather than the types that are actually sitting here. People with claustrophobia may not be the best people to actually be wearing respiratory protection. So it's looking at the whole rather than just one certain part of it. People with epilepsy, if they're wearing respiratory protection, if they suddenly have a seizure, it's looking at the safety aspects of that. Glasses or contact lenses, as we saw, may interfere with some respirators. And making sure that people do have a good fit, not just because they may well have a day's growth or a couple of days' growth, but also people with different shaped faces, if they're quite angular, they may not actually get as good a fit as could be. Spirometry, it was talked about very quickly earlier on. Regular monitoring of airway and lung function by completing spirometry, not just peak flow measures. When we did go out with the mobile unit where we were doing peak flows just as a very quick test. Measures airflow and lung volumes and is the preferred lung function test. Best time to do it is a baseline at pre-employment before people have any exposures. Doing annual spirometry and education. As Donna said, education is everything. Making sure that people know about their own health, know about wearing the respiratory protection or the hazards that they're actually going to be affected or potentially affected by. And spirometry is based on predicted values for individuals' sex, age, and height and weight. So in summary, making sure that you know what your exposures are, getting help if you're not quite sure about what level of exposure, what respiratory protection should be worn, is it worn and maintained correctly, and also what health monitoring is required. Thank you.